So you're bleeding in the stool. What does that mean? Well, it's a common cause of admissions, and as your internist, we're going to go through common causes of bleeding. So we're going to ask for the color of the stool and the color of the blood. There's different shades of blood, from black to tar-like substances all the way to cherry red in color. The color is important because it can try to help locate a source or where in the GI system the bleeding is happening. So usually the upper half or the upper third of your GI, which includes your esophagus, your stomach, and your small intestine, is usually the first third of the small intestine. Any bleed or ulceration there will turn black by the time it exits the rectum. Now, if it's your lower GI tract or lower third, which is usually your colon, we're thinking of bright red blood then. So hemorrhoids can cause bright red blood. Just a few drops in the toilet bowl can look completely red. We also have diverticular disease, which is secondary to diverticulosis. It's a common condition as people get older. They develop these little pouches in their colon from the lack of fiber in a diet over time. We also have angiodysplasias in our elderly. These are all benign causes. And then, of course, some of the more serious causes of lower GI bleeding from the colon can be tumors. In your upper GI tract, you have to think of all sorts of things such as variceal bleeds. Now, usually if you have a problem in your esophagus with variceal bleeding, then you will likely be vomiting up the bright red blood. But let's say you're not able to vomit it, or let's say it's being swallowed, then it's going to come out black. Now, in the stomach, common causes of bleeding there are ulcers and even tumors. And then finally in the small intestine, you can have ulcers as well. Usually an EGD can look at your upper third, and a colonoscopy can look at your bottom third. And ultimately, from one of these or both of them, your GI physician and your hospitalist will be able to determine where your bleeding is coming from.